This is part 2 of the two-part series on exercises for treating low back and hip tension related to prolonged sitting. In the first series, we looked at some stretches, the L5-S1 ELDOA, the iliacus myofascial stretch, and hip external rotation ELDOA. These are exercises to decompress the low back and hips. And now in this video, we're going to go through some exercises to help strengthen the core and the glutes, the muscles that tend to get shut down from sitting too much. Our first exercise will be the dying bug, a very classical physiotherapy exercise that teaches you how to move your arms and your legs without moving your spine, providing stability to the pelvis and low back through good core strength. The second exercise will be a glute bridge, and the way I'm going to show this one is with the legs out on a 45-degree angle, so we get better activation of glutes away from the hamstrings. And our third exercise will be side lying glute med with decompression, which is a really neat exercise because the glute med is the muscle that's most responsible for lateral stability of the hip. However, it also tends to be a culprit for hip compression. So what's cool with this exercise is that it's actually going to teach you how to strengthen that glute med, but at the same time teach you how to use it in a decompressed position. So between those three exercises to strengthen the core and glutes and the three exercises from the previous video to decompress the hip and low back, we've got a really solid workout to treat low back and hip tension. So let's get into it. For our dying bug exercise, we're going to be lying on our backs. And the first thing we're going to do is try to find some pressure of the low back into the floor. To do that, we're going to suck in the tummy and tuck the pelvis until we feel that pressure of the low back onto the ground. Now we want to maintain that pressure throughout the duration of the exercise. However, we don't need to crush the floor as hard as we can. So just make sure you maintain the pressure. From that position, we're going to bring the arms up over the shoulders. We're going to bring the knees up over the hips. Now that we have that pressure against the ground with the low back, the next thing we're going to focus on is deep breathing. And you'll notice that as you inhale, you'll be tempted to arch the low back. I want you to avoid that. Use the strength of your core to keep that pressure of the low back against the ground while maintaining that deep breathing. Now that you have pressure, you have breathing, our third element is adding movement. So the first progression for this will be just very slowly lowering one heel down towards the ground, just before it touches, don't let it touch, and then back up. And then the other leg. So just alternating here. Now if you find that you're already losing pressure of the low back against the ground and you're unable to control it, then I want you to just work here statically. But if you can manage this, you want to take it one step further, we can do that by lowering one leg and then the opposite arm. Again, making sure you maintain that steady breathing and that pressure against the ground. You can perform this until fatigue. If that's too easy for you, the next progression would then be to just do two legs at the same time. And then we can do arms and legs at the same time. And the final progression, which is very, very difficult, is to go with the legs straight, keeping that pressure against the ground, back up, and then finally here. So give that a go, see which progression is right for you. And you want to do probably at least 15 reps of that, and then we can do that for 3 sets in the circuit with the other. After you've performed the dying bug until fatigue, we'll move into our glute bridge. Now the way that I like to perform the glute bridge is by bringing the legs out to 45 degrees. And the reason this is that hamstrings run in a straight line. So when you do a glute bridge with your legs straight, we tend to get a lot of hamstring activity. So if we want to really isolate the glutes, what we can do is bring the legs out to the side because the glutes run on an oblique angle. So you can be lying on your back, look down through the midline of the body, and then from there we're going to dissect 45 degrees, 45 degrees, relative to that midline. Once I've done that, I'm going to do my best to bring my heels underneath my knees. And then the third bit is to figure out the low back angle. So to do that, I'm going to arch my low back as much as I can, tilting the pelvic forward. And then I'm going to tilt the pelvis all the way back until it's flat. Now I'm going to try and find the middle point between those two positions. That's our neutral lumbar spine. We're going to engage the core to maintain that angle throughout the exercise. Now from here, I like to bring the arms out to 45 degrees as well for stability. And then we're going to lift up and back down. Maintaining that low back angle, making sure the pelvis doesn't drift side to side. Now for some of you, this might be very easy. So after the first set, using this to warm up, we can progress into a single leg version. So to do this, I'm going to actively pull one knee up towards the hip, so it's just hovering here. Now, the tricky part about the single leg version is that now that this leg is off the ground, my pelvis is going to be tempted to shift side to side. So I'm going to maintain a soft gaze down the midline of my body, really work the core and use the arms to help me to maintain this neutral alignment of the pelvis so it doesn't shift side to side as I lift up. Now I would do this version for at least 10 reps. If you're under 10 reps, just stick to the 2 legs. There you go. Alright, once you've completed the glute bridge, our last exercise in the series, the side lying glute med decompression. For this exercise, I'm going to be in a side lying position. I like to rest my ear on my bicep. And I'm going to make sure that my rib cage is stacked vertically, that I'm not twisted, and same thing for pelvis. So it should be stacked vertically here, and pelvis in alignment with the rib cage. From here, I'm going to take the bottom leg, I'm going to bring it to 90 degrees. And then from there, I'm going to take the top leg and align it with that foot reaching in. Now that I'm here, I'm going to really think about reaching through the heel of the foot, trying to pull my leg out of socket. I'm going to roll the leg in, pull the toes up towards me. From this position, I'm going to lift the leg up, but as I'm lifting the leg up, I'm continuously thinking about reaching down and out through the heel, pulling my leg out of socket, but also reaching my pelvis down away from the rib cage, so I'm not compensating with the low back. So no pelvic hiking here, reaching out through the heel, internally rotating the hip. I want to make sure that I feel this in the glute and not in the front of the hip. If you feel it in the front of the hip, maybe allow yourself to lift up and back a little bit. Up and back a little bit to help to cheat just a bit to get that glute firing. And so eventually you can just lift up in a straight line. You can progress this exercise by doing a clock, which then allows you to target the anterior and posterior fibers of the glute med as we go through the range. So we can start off here, lift up, down, back 5 degrees, up, down 5 degrees, until you get all the way to here, and then you can start to make your way back as well. And this is a high rep exercise, so we're looking at anywhere from 20 to 50 repetitions on each side. Alright, that concludes this 2-part series on corrective exercises to treat low back and hip tension related to prolonged sitting. If you're watching this video sometime in the future, check the description below for a link to my Patreon account, where I offer early access to these tutorials, but I also post up recordings of my weekly ELDOA and calisthenics classes to follow along to. And I also offer Q&A sessions twice a month where you get to submit your questions so I can coach you along the way. Until next time, I'm Austin Norris. Have a good one.